Hello everyone, my name is Erin Smitley, and today I will be presenting to you my oral abstract and giving you all an inside look to my systematic review presentation that will take place here in a few short weeks. I will be discussing the effects of intermittent fasting on insulin resistance in non-diabetic individuals. So first I will start out with my introduction and give an overview of blood glucose regulation, insulin resistance, energy restriction diets, and then state my purpose statement. Blood glucose regulation occurs in response to increasing and decreasing levels of glucose in the bloodstream. When we eat a meal, the glucose in our bloodstream increases and insulin is secreted from the pancreas. Insulin helps glucose molecules enter cells in our muscle, fat, and liver to be used later as energy, and in doing so, lowers blood glucose levels back to normal ranges. To determine if insulin is being used by the body properly, healthcare professionals will measure blood glucose levels. There are different blood draw tests, and these tests include fasting plasma glucose, which can occur after fasting for at least 8 hours, and is the most reliable if taken in the morning. The A1C test is the average of blood glucose levels over the past 3 months. The random plasma glucose test can be taken at any time, independent of the individual's fed or starvation states, and it is most commonly used when healthcare practitioners do not want to wait for a fasting plasma glucose test, mainly because diabetes symptoms are present. The glucose challenge test is commonly used as the first glucose screening test for gestational diabetes in pregnant women. And lastly, the oral glucose tolerance test, which is also used to diagnose gestational diabetes, can also be used in detecting type 2 diabetes and prediabetes, and can be more effective than the fasting plasma glucose test. Insulin resistance occurs when the body is unable to respond properly to insulin production, leaving excess glucose in the bloodstream and causing elevated blood glucose levels. The exact cause of insulin resistance is unknown. However, excess body weight and physical inactivity are known to be two major risk factors. Approximately 1.9 billion individuals in the world are overweight or obese, which makes insulin resistance more and more prevalent each day. Examples of insulin-related health conditions include type 1 diabetes, type 2 diabetes, metabolic syndrome, and polycystic ovarian syndrome. I just want to be clear with you all that for the purpose of my presentation, the studies will have been done on healthy individuals that do not have an insulin-related health condition. In America, weight loss is a $66 billion industry, with approximately 45 million Americans dieting annually, and half of which use fad diets. Health concerns with fad diets can be very serious. Fad diets frequently develop into serious eating disorders because they promise rapid weight loss and involve unhealthy, unbalanced eating routines and schedules. Muscle and bone loss, nutrient deficiencies, and long-term weight gain can all also occur with fad diets. Energy-restrictive diets are currently under the umbrella of trending fad diets. However, a form of energy restriction, called intermittent fasting, has shown to be successful in weight reduction and maintenance when the diet was followed safely. Researchers are working to discover if there are potential health benefits of intermittent fasting and if they can end up being long-term health benefits. The purpose of this presentation is to educate future dietetic professionals about the effects of intermittent fasting on insulin resistance in non-diabetic individuals. Before I dive into my literature review, I wanted to briefly touch on the inclusion and exclusion criteria for the studies that I have chosen. The inclusion parameters are that all of the studies were done on human subjects that were 18 or greater years of age. They could be normal weight, overweight, or obese, but they just could not be underweight. All of the studies had to be a randomized design, and they had to be published between 2009 and 2019, so within the last 10 years. One thing that I had to eliminate quite a few studies on was if they had an existing insulin-related health problem. So if individuals had prediabetes, type 1 diabetes, type 2 diabetes, polycystic ovarian syndrome, or any other health condition that would make them unhealthy, then regardless of their weight, then those had to be excluded. So the two studies that I will be providing you are two studies on various forms of intermittent fasting and energy restriction. One of the studies will be done on overweight and obese individuals, and the other study will be done on normal weight, healthy individuals. I wanted to do two different studies to compare the differences between insulin resistance in the two different body types. A lot of times in the obese and overweight individuals, insulin resistance has already started to become a thing within their bodies. So I didn't know that if they would have an advantage to this energy restriction, intermittent fasting, to losing weight, if that would improve their insulin resistance more than somebody who is a normal weight and is not already starting to have impaired insulin sensitivity. So the first study will be effects of intermittent or continuous energy restriction on weight loss and metabolic disease. This study will compare two different forms of energy restriction. So intermittent energy restriction would be like Monday, you eat 50% of your typical energy intake, and then Tuesday you eat normal, and then Wednesday you eat the 50%, and so on. And continuous energy restriction would be like if you started intaking 75% of your typical intake and do that on a daily basis, and so in essence continuous energy restriction. In study B, it is 24-hour severe energy restriction impairs postprandial glycemic control in young lean males. This study will compare a control to severe energy restriction. So it's going to be exactly what it says. It's going to be talking about how energy restriction impairs postprandial glycemic control. For my conclusion and implications, you all will have to wait until my systematic review presentation here in a couple weeks. But whenever I do go over it, I will be sharing with you all a summary of my presentation, the strengths and weaknesses from each of the studies, implications for future research, and implications for dietetic professionals. Here are all of my references, and as always, if anybody has any questions, please feel free to reach out to me. I wish you all the best of luck on our systematic reviews.